Hey guys, come along with me today to do some neurotoxin in the upper face. As you can see, I am marking those lateral borders of that frontalis, and then I am spacing my injection sites out, nickel to dime size spacings across that frontalis to ensure that I'm getting a nice even diffusion throughout. Once I have that first line created of injection sites, I'm going in between the first row of injection sites and making a second row. I like to tell people I want you to think of how you're going to get diffusion. You don't want to stack that diffusion on top of itself, but rather make sure you're going to get a nice even spread. We also did the glabella in this area. As you can see, we did a 3-point injection just because this patient was primarily strong in her procerus and her two medial corrugators. She's been treated before in the past, pretty heavy dose in that area, so her anatomy wasn't the strongest, so we decided to play it safe and do a 3-point injection at that origin of those three muscles. So as you can see, I'm injecting across that frontalis. I'm doing about a half needle depth at a 45-degree angle. I like to change sides of my patient just so that I am comfortable injecting, but overall we're getting a nice even diffusion across that frontalis. When wiping your dots away, you're always going to wipe up and away very lightly. You should just be dabbing the area. You should not be rubbing or moving that product because we do not want diffusion to other muscles. When injecting the procerus, you're going to inject at a 90-degree angle, 3/4 needle depth. So as you can see, I'm pinching up that muscle there. And then for your medial corrugators, you're going to be at the origin of that muscle. So that's right where that brow starts, where that animation lies. So we are pinching up on that injection too and treating that at a 3/4 needle depth because that is a deeper muscle. Wiping up and away again and giving your patient post-care instructions.